is inflammation? Now, inflammation is from a Latin, which means set afire, which means it's something getting hot in your body. And usually when you have in a startup of an inflammation, you will notice one of the symptoms is the part that is inflamed, if it's visible. So imagine a sprain or a bruise or a sting from a bee or an infection or a little wound. You will notice that part become really red and hot. Cheryl wrote down something. Give me a second. Well, Cheryl, I hope it will be helpful as well. I really hope this will help you with whatever you're going through, or if you want to help someone else. So there is two different types of inflammation. Now, essentially, inflammation is not a bad thing. It's a way, then a cascade of reaction that your body make together to try to heal itself. So imagine if you wound yourself, the inflammation will start, because the inflammation will raise your immune system to the area to make sure that no bacterial or external particles, they get inside your body and they create even more damage. It will infuse with the blood the area to make sure that all nutrients, they can be sent there and take back all this nasty stuff that might get in, so we can close the wound faster. Will activate all your new vessel, new cells reproduction. So essentially, inflammation is actually a positive thing. The problem with the inflammation is when it's no ending. So if it's protrude through time and it become longer than what is needed, or is activated without a specific trigger. So sometimes our body will activate the immune cascade and will start an inflammation without the needs of it. And that is when inflammation is actually dangerous. So let's see the two different types of inflammation. You have acute inflammation and you have a chronic inflammation. Now, the acute inflammation is what we were talking about, a positive type of inflammation. So you have a trigger, a cut, a bruise, or an injury of any kind, or a bacterial invasion, anything, then it needs to activate a defense method, okay? And that inflammation starts with the heat, the color, as I said in Latin, so the heat, so the parts is become really warm because there is an increase of blood flow, and it become red because we can see through the tissue the blood, so it become red. And after that, it start to swell because the body needs to increase the amount of fluid in the area, so then we can insert immune system cells and all those chemicals like the cytokine, which they are, example, things then we produce to kill bad cells like bacterial or cells may be infected, by example, viruses. And then you will have other triggers like immunoglobulin, then it activates a different immune system to attack the cells then, or the particles that we want to remove. So there is some immunoglobulin that activate, example, the macrophage, which they are white cell, which they are able to englobate in themselves and destroy any kind of particle or any kind of toxin or bacteria that is invading our body. Then it starts the pain, because obviously there is a pressure through the swelling to the tissue. So at that point, we send signals of pain to our brain, and our brain will activate a further inflammation cascade. And usually there is a reduced function of the area which is inflamed. So if everything goes according to plan, once we have in the cascade with an increase of blood flow, an increase of fluid on the area, an activation of the immune system and the nervous system to modulate the inflammation, usually you will have an outcome. In case of acute inflammation, you might have three different outcomes. We'll see them in a minute. If the inflammation doesn't stop, which is one of the outcomes of the acute inflammation, we're talking about chronic inflammation. Chronic inflammation is an inflammation which is persistent through time. It's a lower level of inflammation, so we often don't see the redness. We also don't have many symptoms because it's a sort of underlying kind of inflammation. If it's a quite high level of inflammation, we might see swelling, and we might see pain, and we can feel the pain. But usually we're talking about chronic inflammation when it is a deeper type of inflammation. And it can be all from an acute inflammation, which didn't resolve, or it can be from a genetic backup that we have. So, for example, some of us might be prone to Crohn's disease, which is a typical chronic inflammation of the bowel, or multiple sclerosis, which is a typical inflammation of the immune system, is the immune system attacking the myelin of the nerve. Or we might have, Parkinson, where the immune system attacks specific parts of the brain. So this chronic inflammation, sometimes are not visible until the damage is so big, then it's actually giving you different kind of symptoms.